I know that when I see or hear of another child dying, any child, anywhere dying of unnecessary causes, it makes me angry. I'm angry that because despite steady progress in reducing child deaths in 2011, 6.9 million children under 5 died, mostly from preventable diseases. That's 19,000 children every day. But I hope you do know that you are making a huge difference in the lives of millions of people, and especially children. Thank you for championing the underserved and the disadvantaged. Thank you for speaking up and speaking out for those whose voices are not heard, much less heeded. Your phone calls, your letters, your face-to-face meetings with public officials do work. They do make a real difference. Your network of volunteers and activists amplifies the voices of the most vulnerable. The children denied adequate nutrition, life-saving vaccines, the mothers who risk their lives in so many unnecessary ways when they're giving birth. 3 years ago, my granddaughter, who is of course absolutely perfect in every respect, was born in Massachusetts. She's more than twice as likely to survive until 5 years old as a girl born in Mississippi. And these disparities increase in sub-Saharan Africa. A child born there is on average 14 times more likely to die before reaching her 5th birthday than a child in the United States. 14 times. And the figures for maternal mortality are even more stark. A mother in Sierra Leone is over 600 times more likely to die during childbirth or from complications before or after than a mother in Sweden. Providing children in sub-Saharan Africa with proper nutrition can not only save young lives, but also save $25 billion a year in treatment costs and lost productivity. Scaling up the use of vaccines, already very inexpensive, yields similar benefits. Investing in education for every child, everywhere, benefits not only that child, her health and the health of her family, but also of her society, and especially, obviously, that is true for girls. Educate comes first, because progress on any issue depends first on awareness. And let me speak about the importance of educating people, making them aware through the lens of one of the most underreported, underprioritized, underestimated, and least understood issues in development today, and that is undernutrition, and specifically stunting. 165 million children around the world are stunted. That's approximately half the population of the United States. People don't know that stunting leaves children with less physical growth and more susceptibility to disease. This suffering, those deaths do not need to happen. They must not happen because we can prevent them. Delivering 3 doses of vaccine to women of childbearing age costs about $1.80, less than a cup of coffee around the corner. Your agitation is helping children and their mothers in some of the toughest circumstances to survive and thrive. Together, we have achieved so much for children, and you should be proud of that. But there are so many, many more that need our help. So let's do more. As you monitor government spending to improve child health and education, nutrition, access to clean water and sanitation, and child protection. As you hold governments here in the U.S. and abroad accountable for their commitments to children. Focus on how much of their aid budgets go to the most disadvantaged. And as you continue to mobilize people and resources from the private sector and civil society groups, children and young people, keep them informed of progress and hurdles. Speak up for those whose voices cannot be heard. Support legislation. Use technology and social media to amplify our message. And in doing so, your energy, your passion, and your commitment will help children around the world all finally see the same sunrise.